The Biden administration is taking new steps to fight bird flu, directing hundreds of millions of dollars towards battling the virus that has spread widely in livestock and infected dozens of farm workers. But has the government done enough to prevent a new pandemic? What more must be done to stop the spread?
This week, the Biden administration broadening its efforts to ward off a potential bird flu outbreak in people. The Department of Health and Human Services allocating an additional $306 million. That money meant to help state and local preparedness programs enhance monitoring of the virus and fund additional research. The move comes amid concerns that the virus could potentially mutate and begin spreading between people. Health officials saying they have no evidence of that so far, but some experts cautioning that would be a potential catalyst for another pandemic. But the CDC says the current public health risk is low and that the greatest risk is to animals. The agency has confirmed approximately 66 cases in humans in the last year, with most causing mild illnesses. Some health experts caution that number may be an undercount.
They're monitoring more than 10,000 exposures, but they've only tested 530. What does that mean? That means we're not testing enough. And we know from other viruses that a lot of the spread can be asymptomatic.
In December, an unidentified 65-year-old Louisiana resident with underlying medical problems became the first severe case in the U.S.
Tonight, health officials reporting the first death from bird flu in the U.S. The patient, who was over 65 with underlying health conditions, had been hospitalized in Louisiana since mid-flu in the U.S. The patient, who was over 65 with underlying health conditions, had been hospitalized in Louisiana since mid-December after being exposed to the virus through a flock of birds in a backyard.
The risk is still very low.